Dr. Adalja, we haven't caught up for a while, so I'm really curious to get your kind of updated take on what is happening here. China looks like it's going to ease some of its restrictions. It's doing so as a result of significant public pressure. What happens to cases when it does?
Well, we know that when people socially interact, invariably cases are going to go up. The key thing is keeping those cases from translating into high levels of severe disease that inundate hospitals. And in most countries, that's been done with high levels of vaccination, boosting of high-risk individuals, access to antivirals. And that remains something that China has not done, where their high-risk population isn't optimally protected and they have lower ICU capacity. But it's not all or none. Not everything that China is doing was actually contributing to the decrement in cases. I don't think that having people quarantined at home, which is the normal thing, is going to make that much of a difference, or failing to, or not welding people into their apartment buildings, for example. I don't think some of those activities are actually contributing to COVID control.
So, Doctor, it's good to see you again, by the way. Based on that, can you model what the case count and then hospitalization will look like with these kind of new measures? Because many say that hospitals there are just not prepped for a wave on that front.
I think it's hard because it's not going to be one size fits all for the entire country. This is probably going to differ in different parts of the country, depending upon what level of protection they have from their vaccines, which are inferior, especially in their high-risk populations. But I can expect that we'll see something like a wave occur, and hopefully they're able to occur at times that are not going to inundate the entire country's health system at one point. But what they need to do is actually build ICU capacity. They need to use these vaccines from Pfizer, from BioNTech, from Novavax, from Moderna, from Johnson & Johnson, these Western vaccines, which we know are superior, and they failed to do that. And I think there's still time to do that. They can vaccinate very quickly if they actually wanted to.
Do we know what variants they're dealing with at the moment?
It's hard because it's a little bit of a black box, but they are dealing with some of these next generation Omicron variants, which tend to probably be a little less severe than Delta, for example, but are still severe enough in high-risk populations. But it's likely that that group of variants that we're seeing, these next generation Omicron variants that have basically engulfed the world.
Doctor, from a market perspective, what we kind of try and do here is extrapolate opening from China and case counts, and then trying to understand what it means for them on an economic level. Based on what we know so far in terms of their vaccinations and in terms of their case count, do you expect them to go back to a zero-tolerance COVID policy, or do you think that this is really it and they're just going to make do with whatever vaccines they have and whatever restrictions they can manage?
You may see some retreat back towards COVID zero, but it'll probably be a smarter COVID zero, one that's more targeted towards activities that actually spread the virus, that don't. For example, where having people restricting people's movements outdoors, probably not very valuable in terms of COVID-19 transmission, but you may see more testing and more of their forced isolation quarantine processes, but not so much of the draconian blanket type of measures.
One of the things, if we continue to extrapolate, is that we could see a return of travel, international travel. Does what goes on in China over the next few months represent a risk to the rest of the world?
Not particularly, because I think in the rest of the world we have enough immunity, have enough access to antivirals like Paxlovid, have enough breathing room in our adult hospitals that we don't necessarily think that what goes on in China is going to have any major impact. Yes, there'll be transmission and cases that might occur from that, but largely in most Western countries, what you see is a decoupling of cases from hospitalizations and deaths, because there's so much immunity from vaccines, from natural immunity, and combinations of both of those that are really able to keep our COVID-19 levels and concern to a minimum compared to places like China. So I do think we're in a much more resilient place.
Well, you raise a good point. Also, the therapeutic angle. We have Paxlovid now, so I worry much less about my parents getting COVID when they can have access to Paxlovid. Is it the same situation in China? Do they have the access to the therapeutics?
It's very mixed. I think that Paxlovid is available in Hong Kong, for example, but I'm not sure how available it is in mainland China. China has resisted the use of any Western medicines or vaccines, even if they've been given to them for free. The only people, for example, that can get the Pfizer-BioNTech vaccine are foreigners that live in China.
Just a final question. We are, as you say, increasingly returning to normal life in Western society, in the United States, certainly here in Europe. You see the occasional mask, and I had my latest shot last weekend. So people are keeping current and they're kind of managing the risks. What I am seeing, though, is a significant pickup in colds, but also a significant pickup in flu and other types of respiratory disease. How big a threat does this sort of return of these other respiratory viruses represent in terms of public health, do you think?
Well, right now it is putting some strain on hospitals where they're dealing with COVID, flu, and RSV admissions, and that is putting some issues may bring some issues to light that have been ongoing for some time in hospitals in terms of staffing, in terms of bed space, and that's going to continue to be the situation for the next couple of months. But it's important to remember that these viruses didn't disappear; they were always going to come back, and we do have countermeasures for them. For example, if we get more people vaccinated against flu, I think we can lessen its burden. But this is the new normal, that you have multiple respiratory viruses circulating, and now COVID-19 has been added to this mix. And that really argues that we've got to get better at dealing with respiratory viruses, better vaccines, better antivirals, and really thinking about hospital capacity in a much more proactive way rather than the reactive way that we deal with hospital capacity.
Especially with kids and RSV, it's so debilitating there. Doctor, we appreciate it. It was really good to see you again.